We are focused, we're actually a partnership between University of Rwanda, Connecti3 and Orbital Media, which is a UK-based AI company. We got together about a year ago on the Bill and Melinda Gates Foundation grant that is focused on actually creating an AI tool that will improve efficiency and effectiveness of integrated health campaigns. We have been working, actually we work on all types of campaigns. So most of these are integrated campaigns that include vitamin A, deworming, and many of the other components that Rwanda offers 2 times a year. So the main issues that we found was that the systems were very much manual driven, and that it was very difficult to know whether the integrated health campaigns were actually reaching the vulnerable poor communities that the mission spoke about. And that it was difficult to also know whether the deployment of resources were being optimized, and finally to understand whether the decisions that were being made were the right decisions. What were the trade-off decisions you could have made differently if you had data that was actually automated and AI tool could be used. The big issue about this whole thing was that the AI and big data was not being used as a method for really dealing with this major issues. And therefore, we decided to create what's called a predictive analytics tool to bring a better bunch of data sets together that are publicly available and incorporating the data from Rwanda, Ministry of Health and the Rwanda the RBC, and incorporate both those data, including the past campaigns, to really see if we could actually identify better the vulnerable communities and optimize resource deployment and simulate trade-offs. So the hypothesis of this specific study is really to understand whether the AI tool provides the big use of big data really actually identifies communities better who actually need the services, and whether use of an automated system actually improves efficiency and enables optimization of resource deployment. So that's really the purpose of our study. And we hope that through this study, we will be able to understand whether use of AI and big data is actually beneficial to improving integrated health campaigns. As we mentioned, our primary research is really to see if big data and machine learning really can identify communities better than our current systems that are being used. And then our secondary data is really whether an automated microplanning tool will improve efficiency and transparency and increase collaboration. And one of the things that about tools, as you know, and use of automation is that you really got to understand whether the client who's going to be using these products are actually interested and actually have a stake in it. So there's a significant qualitative piece to this research, which is really going to focus on sort of the user design of the tool itself and the stakeholder perspectives on whether this is actually creating work or is in alignment with their current processes. So anticipated project timeline is really to get our IBR approval in the month of June, July, and August, followed by we are expecting to use the tool for the planning of the upcoming October integrated health campaign. And then comparing that to 2 past campaigns that were done using manual systems, and trying to see whether we see differences, whether the communities we've identified based on our poverty maps and where the campaigns were held was similar to those that was done through manual systems, with the hope that we will have some preliminary results in December. Some of the biggest challenges that we are actually having to face is really the risk of delays as a result of COVID, which I'm sure all of you are feeling the same issues. Part of the thing is that right now, everybody's kind of focused on the COVID, and so there is really no people to actually do any other work. And so we are trying to make sure that the paperwork is as aligned, as clean as possible, so that it makes it easier for the IRB committee to give us clearances. And our bigger risk, the second biggest risk, is that actually the MCH integrated campaign planned for October may not take place. In that case, we are considering actually looking at maybe 2 to 3 past campaigns and doing a comparative analysis using past campaigns. It's not ideal, but given the fact that if it does cancel, then we don't really have much of a choice. So that was really quick and fast, but thank you for your time. And I look forward to our conversation on the whole aspect of integration campaigns.